I'm happy to be here with my colleague Zill Goldstein to talk about LGBTQ health and STI screening. So with that, I will get a little bit started. Oh, next, please. Oh, wait, actually, can you go back? I will introduce myself. I'm sorry. So I am Dina Greene. I am a associate lab director at LetsGetChecked. I also have a faculty position at the University of Washington as a clinical associate professor, and I have spent the last 10 years or so studying how gender and gender-affirming hormones influence laboratory results. And I am joined today by my dear colleague, Zill Goldstein, who is the medical director for transgender and non-binary health at Callen-Lorde Community Health Center. She is an internationally renowned expert in gender-affirming care and the medicines related to STIs and HIV screening. So I'm super excited to have her expertise with us. She teaches me things every single time we talk, no matter what I call her about. So I'm sure I'll learn something even today from this conversation. Next, please.
Thank you for the generous introduction, Dina.
So just a little bit about Let's Get Checked. Here we have two of our amazing nurses. Hello, Jonathan from Long Island. Oh yeah, if you want to throw in the chat where you're from. I'm right now in Seattle. Zill, where are you at?
Brooklyn, New York.
Brooklyn. I think that's where somebody in this picture right here, this is Kristen. I see her on. She's our one of our amazing head nurses. And Mel over here, who is another one of our amazing nurses, and our medical director, Dr. Rob. And together we are a global healthcare solutions company that gives you the tools to manage your health from home, providing direct access to at-home tests, virtual care, and pharmacy support for a wide range of health conditions. Yes, everyone's faves, KO and Amal, Brooklyn, Louisville, hello, Long Island. Amazing. We offer tests that include sexual health, men's health, women's health, and wellness. Next slide, please. So today we're going to talk a little bit about health disparities, chronic disease management, sexual health testing and treatment, HIV testing and treatment, and prevention. No treatment there, I don't think yet. Well, there is treatment, but that's not what we're going to talk to you about. It's a chronic disease. It's not an ending life sentence like it used to be. So it's, there is treatment. Don't despair with that. Transgender health and resources for receiving quality care. Okay, so the LGBT community faces health disparities like most marginalized populations do, right? Whenever anyone is not in like the typical mainstream white, heterosexual, middle class, there's going to be disparities in those populations. And so this leads to avoiding access to care or being dissatisfied with your care. And oftentimes, because LGBTQ people have experienced discrimination before, they automatically assume that they're going to experience discrimination again. And so you have this twofold thing there where one, people truly do experience discrimination, but then on the other hand, people will present a little bit defensive sometimes because they're scared that it's going to happen to them again. So there's some statistics over here. I think that, you can look at that graph. It's pretty easy. I don't have to read it for you. So next slide, please. So this lack of education is one of the health barriers. That doesn't mean that LGBTQ people aren't educated. They are educated. Some are educated, some are less educated, I'm overeducated. It doesn't mean that I'm super smart. But studies have shown that we don't train in medical school about alternative sexualities, how to improve care for the LGBTQ population, and how care for LGBTQ individuals might differ from their non-LGBTQ counterparts. And also, we say LGBTQ like it's one thing, but like if you're a lesbian, you have different concerns than if you're a gay person, and also depending on what your anatomy is. So if you're a trans person, you are going to have some needs that are different depending on if you're a trans man or a trans woman, and that may or may not differ from your lesbian and gay counterparts. But overall, it is a real just a need to be open to the diversity of the human experience, human sexuality, and gender diversity. I already talked about the fear of discrimination and judgment, so I don't think that I need to harbor that. We all know, we all read the news, or at least watch a TV commercial. So there are some of the barriers to healthcare for LGBTQ people, the gender, race, and socioeconomic status. So as I said, when you are not part of any of those majority categories that are less oppressed, then you get put into different ways, and there's intersection of those things. And so being LGBTQ can influence your ability to earn wealth. It can influence your ability to be confident when you present to different things. It can limit your ability to have parental support for education or other things. So there have been found that that having these identities will negatively impact your health. And there's also a real lack of representation and inclusivity in clinical trials. Really, this is for mostly for the trans community, that there is not representation in clinical trials. And so there is a real lack of documenting the transgender experience throughout all systems. So we don't collect gender at the DMV, we don't collect it in our electronic medical record systems, we don't collect it in the census survey. And in fact, it is now even illegal in some states to have that identity, more or less, except, there's things being challenged in courts. I'm not a lawyer, so I won't get into that. But so all of this combined leads to an erasure. So an erasure of people and an erasure of an existence. So that doesn't translate well into doing research appropriately on minority populations. Next, please. So, but it's really important for all of us to have inclusive and affirming care. One, because you never know. You really, we think oh, even if you are a, middle-class, heterosexual, white person with that is able-bodied and all of the things, you got a real good deck of cards, or, your hand was dealt good, great for you. Your best friend might have a kid that's trans, or you might your sister may have an alternative sexuality. And so there's the people that you love, that may end up being affected by this. But also when we normalize these identities, when we normalize diversity, it helps everyone. It means that everyone can go to the doctor, and you can be treated more like the unique person that you are. Next slide, please. Okay. So studies have shown that sexual minority men and women experience a higher risk of cardiovascular disease. This is also prevalent in the Black population. There is this thing called a minority stress. And it's that when you are scared about your identity and you are scared about the way that people are going to treat you, you live with chronic anxiety. And chronic anxiety leads to chronic disease. It's its own disease. And then it exacerbates everything else that's going on. And so the more folks can feel included, the less fearful people are for being discriminated against for their identity, the more likely they are to not suffer from concurrent diseases unnecessarily or not exacerbate their chronic diseases. Next slide, please. So managing chronic illness is, it's complicated, and it has been shown that for folks with chronic illness, like I said, if you increase their confidence, if that will improve physical and physiological well-being. And so having ways to manage these chronic conditions and motivating ways to manage challenges that are associated with chronic diseases is kind of one of the reasons that I do the work that I do. It's how can we provide accurate lab results? How can we ensure that the reference intervals are appropriate for transgender people? How can we make sure that people have access to the screening that they need for whatever type of sexual activities they have? Next slide, please. So telehealth services can help with some of this because you avoid that barrier to having to go somewhere to see someone and disclose these things in public. It gives you the opportunity to do something in the privacy of your own home. And perhaps you live in a state where you feel less safe going out, but you can have telehealth with a provider that lives in a state that you would probably feel more comfortable with, or at least works for a company that is headquartered in a state. I think that medical laws, again, I'm not a lawyer, so I don't know how all that works, but I think that you have to practice within your state boundaries, or there's some, I don't know, Zil, do you know what the rules are for that?
Yes, you have to be licensed in the state where the patient is. So I'm only licensed in New York, and I can't treat patients in California, for example. There's interesting stuff going on now with like care bans in different areas and states passing laws saying that you don't need to be registered to do certain kinds of care, like namely abortion care and gender affirming care. But that, anyway, I could go on. I will not go on about.
No. It's so interesting. But I think that because I do have colleagues that I have a colleague that's in Atlanta that provides gender affirming care for youth. And she has she treats all throughout the Southeast, and so she must have licenses in those other states, or somehow has some sort of a way of linking that. So it's complicated, but it does provide a much safer environment for people to get care. Next slide, please. Right, I'm gonna hand this over to you, Zil.
All right. So how common are sexually transmitted infections, or STIs? STIs are very uncommon, and the CDC, very common. STIs are super common. Herpes especially, super common. 1 in 5 people has had an STI according to the CDC. What we see the most of are bacterial STIs, so things like syphilis, gonorrhea, chlamydia. Those are particularly common among gay, bisexual, and other men who have sex with men. So, they're all the reason we make the distinction is because all of the most common STIs like these are treatable with antibiotics. So you get chlamydia, you get syphilis, you go to the doctor, you get some antibiotics. Generally, you're good to go. It's the viral STIs, not so much HIV that I'm thinking of right now, but like human papillomavirus, particularly that can cause cervical cancer and anal cancer, that are really, from a clinical perspective, more difficult to treat. There are many steps you can take to protect your health, such as regular STIs, vaccinations, particularly for hepatitis A, B, and HPV. So our goal with HPV, the vaccination has been around since 2008, I think, and it has had a significant impact in the number of HPV cases that we see. So I recommend, and it's now covered at all ages by all insurances. There was a change in the recommendation before. You could only get it up to age 26. So if you haven't gotten the HPV vaccine, you should go out and get it. Next slide, please. STI safe practices and testing. We want to make sure you're vaccinated. You want to practice safe sex. That's something that is a little bit of a controversial recommendation these days. Barriers, especially in the cis gay male community, have gone out of fashion because everyone's on PrEP. But PrEP is medication that you take. There's now a shot that's available every 6 to 8 weeks, or a pill that you can take daily that will prevent you from being able to acquire HIV. It reduces your chances by about 95%. So PrEP is another missing piece of this slide, but regular STI testing is key. Some people say you should test every time you get a new partner. I don't know about you, but there's times when I need to be tested 3 or 4 times a day if I'm having a really good time. So it really depends on how common different STIs are in the place where you are having sex. That's really what determines your testing interval. But I recommend most people who have multiple partners on a regular basis get tested at least every 3 months. Treating STIs, we talked about this a little bit. Bacterial infections like gonorrhea, syphilis, chlamydia, and trichomoniasis. Trichomoniasis is a vaginal STI, so it's a little bit different than what we've been talking about before, but it is responsive to antibiotics prescribed by a medical provider. Antivirals can be used in herpes to suppress outbreaks when they're happening and also make them less frequent. And HIV is treated with antiretroviral medication. There's no cure for HIV, but it can be effectively managed with treatment. And like we talked about, PrEP is medication that can be taken to prevent HIV. What's not in here is advances in hepatitis C treatment. Hepatitis C can be sexually transmitted. We're seeing a lot of that in New York, and luckily there are new treatments available in the past few years that have made it a much more treatable disease. Next slide, please. Destigmatizing STIs. It's important to acknowledge how common STIs really are and not to feel ashamed if you contract one. Communicating with your partners is super important if you test positively. If you test positive, you should always test positively. Bring a good attitude to your test. As long as you feel safe to do so. And a lot of city and state governments have partner disclosure programs where if you feel like you'll be in danger disclosing to someone that you potentially gave them an STI or that you got an STI from them, that you can have someone from the state or city call your partner and let them know that they were exposed to someone with an STI. And one of the great things about LetsGetChecked is that you can test for STIs at home. You don't have to go into a doctor and say, I had sex, now it's your turn to shame me before telling me what tests I can get. You can just do it at home. So more on HIV testing and prevention. HIV attacks the immune system. It stands for human immunodeficiency virus. And it destroys CD4 cells that are involved in fighting disease and other infections. So what's particularly nasty is that these are like the alarm bells, right? So your immune system, you can think of it as an alarm system on your house, and HIV goes after the bells that tell you when something is wrong. So an estimated 1.2 million people in the US have an HIV, and gay and bisexual men are more affected than any other group. Testing is the first step to knowing where you stand, and the CDC recommends that everyone between the ages of 13 and 64 get tested for HIV at least once. Next slide, please. There's different kinds of HIV tests that you can get. If HIV isn't treated, it can lead to acquired immunodeficiency syndrome, which basically it means your immune system has deteriorated to the point that it can't protect you from everyday diseases that our immune systems usually keep at bay. But the different kinds of tests that are available are antibody tests. So those are most of like the rapid tests that you get that are like, if you have a 1-minute test, some of the 20-minute tests are antibodies. But now the 20-minute tests we're seeing are more antigen antibody tests. So those look for both HIV and they look for HIV antibodies. So the antibody test only looks for antibodies, and there's potentially a 2-week to 3-month delay before you develop antibodies, and the antigen tests are positive within 2 weeks, within a couple days even. So antigen antibody tests in combination are super important. And then when we use nucleic acid amplification tests more often when we're treating HIV and we're looking at how many copies of the HIV virus is in someone's blood. We don't usually use these to test whether or not someone has HIV. They really are more for monitoring the effectiveness of HIV medications. To prevent HIV, never share needles, syringes, or any other drug injection equipment. Use condoms or take PrEP. If you're not on PrEP and you're exposed to HIV, so PrEP stands for pre-exposure prophylaxis for HIV, which is like before you're exposed to HIV, you take something and it prevents it. PEP is post-exposure prophylaxis. So like I went out, I had a good night, oops, I didn't use a condom, but now I'm worried that I could have gotten HIV. because they had unprotected sex. So then you take a month of medications, and after a month, you get checked for HIV again, and no one who has taken their post-exposure prophylactic medications as directed has ever tested positive for HIV. Next slide, please. We treat HIV with antiretroviral therapy. Antiretroviral is a fancy word for the kind of virus HIV is. It's recommended for everyone who has HIV, and it's usually 3 medications, and in certain cases, 2 medications that you take at the same time. Before people had to take 10, 15 pills a day just to treat their HIV, but now most regimens that we use are between 1 and 3 pills. So again, this doesn't cure HIV, but it stops it from replicating, so it can't harm your body. People who take medication live a much longer and healthier life. And also, if they're taking their HIV medication regularly and their HIV is treated effectively with that medication, then they can't transmit HIV. So undetectable, which means you have no HIV virus that we can detect with that nucleic amplification test, is untransmissible. ART works by lowering the amount of HIV in your body and can take up to 6 months to become undetectable. If ART works well enough to the point where tests can't find HIV in your blood, this means you have an undetectable viral load, like we said. And if you have an undetectable viral load, you can't infect anyone with HIV through sex. Next slide, please. Transgender health. Transgender and non-binary people have the same basic care needs as cisgender people, but also get gender-affirming care, which can be things like, hormone therapy, surgery, voice therapy, but also can be things like your haircut and the way you dress and how you walk down the street. So there's a lot of different ways that we make gender happen in our lives, right? So think about it, you get dressed, you put on specific clothes. There's men's clothes and women's clothes. So you can change what kind of clothes you wear if you're trans without any medical intervention. You can get a different haircut. You can get a blue toothbrush instead of a pink toothbrush if you want. These are all things that people do to help express their gender. Next slide, please. Addressing trans and non-binary care needs is something that's important for everyone. And what's also important in delivering that care and receiving care is getting care that's customized to the needs of the specific patient. There's not a lot of doctors who know how to do this. So sometimes it can be hard to find a doctor who will be able to prescribe hormones or take care of you if you're trans. And a lot of trans people know good doctors. A lot of LGBT organizations have lists of good doctors who will take care of trans and non-binary people. So in most metropolitan areas, there is someone doing trans and non-binary healthcare. It's a little bit harder in rural areas to find someone. And there's all sorts of studies showing like trans people will drive 8 to 10 hours to get to a medical appointment to get their hormones prescribed. Next slide, please. So the lack of education that Dina was talking about before is really a big issue. So we have, there's different ways people talk about it. I talk about estrogen and testosterone-based hormone replacement therapy. Some people talk about feminizing and masculinizing therapy. But really, if someone is on the trans feminine spectrum, so they were male assigned at birth and are moving to becoming a woman or are living as a woman, or some other feminine identity. There are non-binary people who identify as trans feminine. We use estrogen, testosterone blockers, and the use of progesterone is actually somewhat controversial. There's a lot of arguments about it in the field. But then for transmasculine people, so people who were female assigned at birth and are going towards or living in a more masculine identity, will take testosterone, which can be administered in injections. The patches actually just went off the market, and I don't know if there's a generic manufacturer yet. But there's topical creams, and there's also a pill, but you have to take the pill twice a day. So a lot of people don't end up taking the pill because they forget to take it twice a day. Just depends on what's easiest for you, remembering a shot once a week, a cream every day, or taking a pill twice a day. So it's important to understand your body and what works best for you, both in your body and in your life. And always seek medical advice and guidance before taking any medication or hormones. It's good to, it's not feasible for everybody. I don't want to shame anybody who started hormones without medical supervision, because sometimes that's the best way to get them. A lot of people who don't have health insurance will just order them from Canada, or Mexico or Germany. There's a lot of talk about like what are the best hormones to buy? Is it the Mexican hormones or the German hormones? And I spent a lot of time unpacking things like that. Say now we use FDA approved hormones. Next slide, please. Receiving the quality care you deserve. Dina, do you want to take this one?
Sure, I'll go for it. I may call you in or pull you back. So at-home healthcare, we should all be able to go to the doctor's office without the fear of being judged. Unfortunately, that is not the reality for many of us. So this is back to, the quality of care for people, where it's important that everyone is accepted. And so at Let's Get Checked, we do offer a range of options, testing options that allow you to check your health from the privacy and comfort of your own home. So I think, the STI testing is so valuable, so important to have access to that in a way that is easy to access. We also can look at hormone concentrations. So if people either don't have access to healthcare often, or you can look at, or if you are using hormones in a way and you're not sure if it's the right way, and looking at the hormone concentrations that we offer here. Okay, next please. So virtual consultations for just $49. We even offer clinical guidance following a virtual consultation with a healthcare provider via our secure messaging platform, like Kristen or Mel that were in that first slide. It is fully private, discreet, and a safe way to access the quality of care that you need. And our providers can even arrange for medication prescriptions to be sent to your local pharmacy if you need them for hassle-free pickup. So I can't remember, I always forget, I don't prescribe medications. I only know the testing side. And I know that chlamydia is oral, gonorrhea is injection, or is it the other way around?
Yeah, so for chlamydia, you can take an antibiotic called doxycycline, which is a pill that you take twice a day. And one thing we actually didn't talk about is that you can take doxycycline preventatively to keep you from getting syphilis or chlamydia. So that's a new thing. That's just the first study came out, I think, just before the pandemic, and it's called DoxyPrep. But yeah, for gonorrhea, you need an injection of an antibiotic called ceftriaxone. It just needs a higher dose to treat what more than we can give orally. There's oral medications for gonorrhea that we only use in extreme emergencies.
So, okay, next slide, please. Thank you. So to learn more about our health tests, you can visit LetsGetChecked.com, and you can look at, and here's the code for you for 25% off all of our health tests. So wellness 25 right there. And as long as you purchase by May 31st, you can get this special code. And if you purchase it, you purchase it before, but I think you have like 8 weeks to use it or so. I'm sure that's indicated on the website. But so you don't have to need it right now. You can get it, and then you have a good night and you're like, oops, I didn't use protection. And there you go. You can use it, send it in the next day, and really have results within maybe 2 sleeps or so. Next, please. Oh, and so we will now open it up for some Q&A. And so first I'll just open it up in the chat. We've got some icebreaker questions here, but I want to see if there's any other. Nathan, I would be interested in taking a look at the satisfaction study in its entirety. Is this information available? I am not sure about where the content came from for these slides, but there is definitely the National Gay and Lesbian. So what is that called? The folks that do that big survey that's about to come out again. He gave a talk with ASA.
The National Gay and Lesbian Task Force.
Yes, the National Gay and Lesbian Task Force, and they do the that big study, and they're about to publish it. And there is literature about this. And if you I don't know, maybe one of the folks that either Rebecca or Carolyn that are hosting this can help you to ask that question. If you need references to that, we could send them. Any other questions in the chat? Yeah, you're welcome. Okay, what are the facts regarding the new bill passed by DeSantis in Florida? What do people in Florida need to be aware of? So the first thing is there is very complicated legal ground around this right now. So as far as the details of the bill, it really matters if somebody has challenged that bill yet and whether the court has allowed for that bill to be stopped. I know for many of these, the bills have passed by the legislator, but they are now stuck in court because they are not ethical. There's a real good podcast by it's called First
It's not that they're not ethical, it's that they violate the US Constitution.
They violate, that's yes. So they violate the US Constitution. Exactly. So they violate they're human rights violations. And
as well as being constitutional rights violations.
Yes. And so there's a really good the New York Times has a podcast, First Person, and Lulu Garcia did one with state senator from Utah that was a conservative Republican that chooses to do the constitutional right and has voted in favor of trans rights and tries to convince his colleagues the same. And he said that at that point, so many bills have come up since then, but at that point he said there has not been one of these bills that have been introduced that has actually been able to make it through the legislature because of the constitutional violations. They're just so clear. I grew up in Florida. I don't usually say that on record, but it is really frightening. It is very, very frightening what's happening there from my perspective. Oh, thank you, Eric. Do you have anything else to say about Florida, Zil?
I mean, there was another question about advocacy, and there's a ton of advocacy going on right now. So the study that said that there were no medical schools teaching LGBT content is actually from 2011, and a lot has changed since then. There's a lot of queer people working in medical schools who have done a lot of curriculum changes. So another study needs to be done about how medical schools are teaching LGBT content, but it's not, I mean, it's better than it was in 2011 when that study was published. What Dina mentioned with the survey, the US Trans Survey, you can keep an eye out for. That's done in collaboration with several nonprofits. It doesn't have an academic sponsor. There's no academic institution that's taken it on. So it's a more like nonprofit gray literature source, but it is one of the best sources of information that we have. And they're actually taking a long time to sort through the data. I'm not sure when we're going to get publications for the US Trans Survey, because a lot of people gave them junk data. Like part of the wave of anti-trans sentiment in this country right now is like interfering with anti-trans science or interfering with trans science. So it's something we really have to be careful of. And it's something that the people who are running that survey are taking into consideration before stating any results. They want to make sure that their results are good.
So another question came in here. What does Medicaid or CHIP cover for gender affirming care? Per my research, I saw that Medicaid was one of the largest providers of puberty blockers. What else is made available for transgender individuals, especially adolescents? So I do want to take a quick, neither Zil or I work with the pediatric population. We're both, we both work with adults, but there's a lot of misconception around the treatment of transgender youth. Most kids are experimenting with gender, are going through different types of distress, and are having, everybody has a gender, and and it's really about allowing, like Zil was saying, allowing people to have the haircut that they want, allowing people to be called the name that they identify with. allowing people to dress the way that they, that expresses the gender that they are feeling as they are developing. In some cases, children will be offered puberty blockers. Those puberty blockers, they're almost all reversible changes. There may be a slight change in bone density, but that's why people can't stay on puberty blockers forever. And it gives parents and their child a window to figure out what is going on with that child and what that child's gender is. There's not surgeries that are offered to most youth. There may be some teenage cases where there is full consent available from the doctor, the child, and the parent, and those can happen. But for the most part, anything that is done in youth is fully reversible. Zell?
Yeah, and there's a single study that shows that the bone density loss on 7 years of puberty blockers is made up once you start hormone therapy within 2 or 3 years. So, again, we're just ignoring the science and the popular media. But, this whole thing about like Medicaid is administered state by state. It's a block grant program. So the federal government gives each state a bunch of money and says, do your Medicaid. So each state determines on its own what Medicaid covers. I don't even know how you would measure Medicaid being the largest provider of puberty blockers, because you can't really tell. Like, puberty blockers are a class of medication. They're used to treat precocious puberty and a few other medical conditions that involve overproduction of sex hormones, right? They're used in the same medication that's used as puberty blockers is used in prostate cancer treatment, right? So Medicaid may be the biggest dispenser of the medication classes called gonadotropin releasing hormone agonists, but we don't know, there's no repository of all of the Medicaids, every medication that was filled under Medicaid and why it was filled. Like, I don't even have to say what puberty blockers are for. I can just say this patient needs puberty blockers. And then most of the time, the insurance company wants prior authorization, which is the insurance property knocking on my door and saying, you need to justify the use of this medication. And then it depends on what state the patient is in for what I'm going to tell them is the reason for that medication.
Thank you. Tyler asks, I work in a holistic health practice, offering nutrition, supplements, mental health therapy, spiritual coaching, Reiki, yoga, and other services to help offer holistic support to clients. We partner with a number of physicians in helping clients through their health journey. What are some things that could be helpful to know as we assist these journeys for therapy, nutrition, supplements, etc.? So my take on this is it would be almost exactly the same as it would be for cis people, but normalizing gender diversity by asking people their pronouns, even if you look at them and you assume that they're cis, normalizing that people have different types of sexual behaviors and allowing them to talk about them comfortably, and respecting people's identities. So having a culture of respect so that people feel safe telling you what is wrong with them and how you can help them. Scylla, do you have anything to add to that?
Not really. I prescribe a lot of B12 and folic acid for my trans women because it helps hair and nails grow. That's the supplement that I use the most.
Perfect. And vitamin D, of course, for y'all in New York, well, and me in Seattle.
Yeah.
Thank you, Melissa. Thank you, Jim-san. Any other questions here? Thank you, Tyler. Okay.
Next time we'll go on tangents for longer because we have so much time.
I know. Yeah. Okay, well, if there are